हाँ जी, वेलकम करते हैं तुहाडा सारे स्टूडेंट्स का नर्सिंग करियर चैनल के उत्ते। सो काफ़ी इंपॉर्टेंट मल्टीपल चॉइस क्वेश्चन ने स्टार्ट करते हैं आप अज की नैक्सट वीडियो। सो फर्स्ट क्वेश्चन हैगा टोटल ड्यूरेशन ऑफ ह्यूमन प्रैगनेंसी इज़। सो वट इज़ द टोटल ड्यूरेशन ऑफ ह्यूमन प्रैगनेंसी इज़ A 9 months, B 37 weeks, C 280 days and fourth is 42 weeks. So the right answer is 280 days. So option C is the right answer. Question second हैगा जी the enzyme which is helpful in the entry of sperm into ovum. So the enzyme which is helpful in the entry of sperm into ovum is A hyaluronidase, B secretin, C cholecystokinin and D renin. So the right answer is option number A. Hyaluronidase is the right answer. Next question number third. Pear shaped water bottle heart is seen in A TOF, B ventricular hypertrophy and C pericardial effusion, D dextrocardia. So the right answer is pericardial effusion. Pear shaped water bottles heart is seen in pericardial effusion. C is the right answer. Next question number fourth. Most important step to prepare patient for paracentesis is A check vital signs, B preparing the puncture site, C wait the cleint, D ask the patient to empty the bladder. So what is the most important step to prepare patient for paracentesis is ask the patient to empty the bladder. So option number D is the right answer. Question number fifth. The birth weight of the baby triples at 9 months, 12 months, 15 months, D 18 months. The birth weight of the baby triples at 12 months. So option B is the right answer. Next question number sixth हैगा which teeth erupt in a baby? A lower central incisors, B lower lateral incisors, C upper central incisor, D upper lateral incisor. So which teeth erupt? Lower central incisors. Teeth erupt in a baby. So option B A is the right answer. Next question number seventh. Blue bloater is seen in A COPD, B emphysema, C ARDS, D SARS. So blue bloater is seen in COPD. So option A is the right answer. Next eighth. The most heat sensitive vaccine is A oral polio vaccine, B BCG, C TT, D DPT. So most heat sensitive vaccine is oral polio vaccine. So option A is the right answer of question number 8. Next question 9th. The vaccine not to be given in pregnancy is MMR, rabies, hepatitis B, diphtheria. So which vaccine is not given in pregnancy? A. MMR is not given in pregnancy. So A is the right answer. Question number 10th. Egg is deficient in which nutrient? A. Proteins, B. Fats, C. Carbohydrate, D. Minerals. So egg is deficient in which nutrient? Carbohydrates. So option C is the right answer. 11th. Food fortification means A. Adding bad things to the food, B. Adding nutrients to the food, C. Assessing nutritive value of the food, D. Grading system used in classification of food. So food fortification means adding nutrients to the food. B is the right answer. 12th. Disinfect used for blood spills is phenol, B. glutaraldehyde, C. ethanol, D. sodium hypochlorite. So disinfectant used for blood spills is sodium hypochlorite. So the D is the correct option. 13th. Zero dose of polio is given at A. Before giving DPT, B. At birth, C. When child is having diarrhea, D. When child is having polio. So 0 dose of polio is given at the birth time. So option C, B is the right answer. 14th, pasteurization is a dash disinfection. A. Precurrent, B. Concurrent, C. Preconcurrent, D. Terminal. So pasteurization is a precurrent disinfection. So option A is the right answer. 15th, the following vaccine, if contaminated, can cause toxic shock syndrome. DPT, B. Hepatitis B, C. Typhoral, D. Measles vaccines. So which vaccine, if contaminated, can cause toxic shock syndrome? The right answer is measles vaccine. Option D is the right answer. 16th, ASHA covers the population of. So ASHA workers, how many population covers? 1 lakh, B 1000, C 10,000, D 5,000. So ASHA covers the 1000 population. B is the right answer. 17th, risk of damage to the fetus by maternal rubella is maximum if mother gets infected by 6 to 12 weeks of pregnancy, 20 to 24 weeks of pregnancy, C 21 to 25 week of pregnancy, D 32 to 36 week of pregnancy. So risk of damage to the fetus by maternal rubella is maximum if mother gets infected by 6 to 12 weeks of pregnancy. So the right answer is A. 18th, AFB surveillance is mainly conducted for GB syndrome, neuritis, transverse mellitus, polio. So AFB surveillance is mainly conducted for polio. D is the right answer. 19th, the most common salivary glands infected in pumps is A. Sublingual gland, parotid gland, submandibular gland, mucus gland. So most common salivary glands infected in pumps is parotid gland. So option number B is the right answer. 20th, the nursing care for a postpartum client should suspect that the client is experiencing endometritis if which is noted: breast engorgement, B. elevated white blood cell count, C. lochia lubra on the second day postpartum, D. fever over 38 degrees Celsius beginning 2 days postpartum. So nursing care for a postpartum client should suspect the client is experiencing endometritis if the fever over 38 degrees Celsius यानी कि 100.4 degree Fahrenheit beginning 2 days postpartum. So the right answer is option D. 21st, which of the following is called as Hansen's disease? A. tuberculosis, B. plague, C. leprosy, D. tetanus. So which of the following is called Hansen's disease? Leprosy. C is the right answer. Next set, 22nd, copper T is ideally inserted at A. just before menstruation, B. on 26th day, just after menstruation, on the 14th day. So copper T is inserted at just after the menstruation. When the menstruation is complete, then copper T is inserted. So option C is the right answer. 23rd, after liver biopsy, the nurse should assist the client to lie down in which position? Left lateral, right lateral, supine, semi-fowlers. So after liver biopsy, the nurse should assist the client to right lateral position. B is the right answer. 24th, the most important instruction the nurse will give the client taking corticosteroids is A. to take the medicine empty stomach to increase sodium intake, C. to decrease dose in periods of stress, D. to taper the drug and not to stop abruptly. So the most important instruction the nurse will give the client taking corticosteroid is to taper the drug and not to stop abruptly. So the right answer is option number D. 25th, in NVD PPH is after loss of dash ml of blood. A 1000 ml, B 700 ml, C 500 ml, D 250 ml. So in NVDP PPH is after loss of 500 ml of blood. So the right answer is option number C. 26th, the bronchoscopes are sterilized by using which of the following solutions? A. Phenol, B. Hydrogen peroxide, C. Sodium hypochlorite, D. Glutaraldehyde. So bronchoscopes are sterilized by using the glutaraldehyde. Option number D is the right answer. Then move to the 27th. Example of third generation IUD is lips loop, CUT380AG, and LNG20 Nova T. So example of third generation in intrauterine device LNG20. So the right option is C. 28. GTT to detect gestational diabetes is done at 12 weeks of pregnancy, 28 weeks of pregnancy, 37 weeks of pregnancy, as soon as pregnancy is detected. So GTT to detect gestational diabetes is done at 28 weeks of pregnancy. So the right answer is B. 29th, mask-like face is the characteristic feature of A. Alzheimer's disease, B. Schizophrenia, C. Parkinson's disease, D. Multiple sclerosis. So the mask-like face is characteristics or feature of Parkinson's disease. Option C is the right answer. 30. DVT is indicated by A. Homan's sign, B. Kerning sign, C. Trousers sign, D. Chico's sign. So DVT is indicated by Homan's sign. A is the right answer. 31st, according to WHO, the cut-off point for anemia in pregnant woman is 13 gram, 12 gram, 11 gram, 10 gram. So according to WHO, cut-off point for anemia in pregnant woman is 11 gram. So the right answer is C. 32. In a patient with herpes simplex, so the nurse should take which precaution? A. Airborne, B. Droplet, C. Contact, D. All. So contact, C is the right answer. 33. In a preoperative period, the consent should be taken. A. Before giving preoperative medications, B. After giving preoperative medication, C. In the operating room, D. After surgery. So in a preoperative period, the consent should be taken before giving preoperative medication. So option A is the right answer. 34. The insensible water loss occurs through GI tract, lungs, kidneys, sweating. So insensible water loss through lungs. Option B is the right answer. 35. The nurse should withhold the NG feed of the patient if residual means aspirate is more than 500 ml, 300 ml, 200 ml, 100 ml. So the right answer is 100 ml. 36. Client with iron deficiency anemia is taking iron supplements. So the nurse emphasizes to the client that the drug will have increased absorption if taken with milk, orange juice, food, beta carotene. So iron deficiency anemia is taking iron supplement. So if they increased absorption, if we are taking orange juice with the medicine with the orange juice. So right option is B. So 37th, the nurse is caring for a client who has been placed on droplet precautions. Which of the following protective gear is required to take care of this client? Select all that apply. So caring of a patient who placed on droplet precautions. So what protective gear we should use? Gloves, gown, surgical mask and glasses. Both option A, B, C and D we are used during the care of the droplet precaution cleint? So the right answer is A, B, C and D. So these are the questions today we will discuss in this video. This is very important MCQs. So okay, take care.